We were very pleased that very recently ANZCA hosted the Council of Presidents of the Medical Colleges, or CPMC, here at ANZCA House. As part of that meeting, the Australian Federal Health Minister, Mark Butler, came to speak directly face-to-face with CPMC. When he arrived, his staff had asked if we could provide him with a quick snack for breakfast, but this gave myself as host, but also Sanjay Jagannathan, who is the chair of CPMC, to sit down with Minister Butler and his staff for about 15 minutes and talk through some of our concerns. This very high level of communication that was very positive really indicates how far we've come in our relationship with government, but also the ability to communicate to the highest levels of government. This included the importance of the quality of clinical care and our concern about workforce wellbeing. As part of the CPMC meeting, we had a chance to talk to representatives of a number of authorities, including the Federal Health Department, the Australian Medical Council, the Medical Workforce Advisory Collaboration, and others. And this gave a chance to really have a two-way flow of information. I must say it was incredibly collaborative. One group we also spoke to was the Medical Board of Australia. And one question I really wanted to ask them, aware that many fellows do find CPD a major demand each year, as to whether they would consider moving back to a 3-year cycle rather than a 1-year cycle to try and reduce the overall burden. They were fairly equivocal on this, but I think it's something we should continue to pursue. One of the issues in CPD is that our regulators, the Australian Medical Council and through also the Medical Board of Australia, mandate how the college manages CPD, which really ties our hands in many ways. However, we do need to recognise that CPD is very important, but how it is undertaken can undoubtedly go through further reform. So Nigel Fidgen, who is the current CEO of ANZCA, told me as president, but also as the chair of the board of ANZCA as a company, that he will be retiring early for personal reasons by about mid-December. So that means again that the board and me as president need to lead the selection of the next CEO, and that is now in process. One person I'd like to acknowledge, who most fellows will never meet, is Brett O'Meara, who is Executive Director of People and Corporate Services, that is, if you like, HR and finances. And he has been instrumental in really helping us have a very good process in selecting the new CEO. And we've had very high quality applicants already. We'll have interviews during October and then an appointment ideally before Nigel Fidgen retires in mid-December. We are very aware that the CEO plays a major role in the operational side of the college, with strategy led by council. And whilst it might seem removed from the everyday lives of many fellows, it is very important in the future and stability of the college that we, as those making these decisions, do a good job to find you a good new CEO. I recently visited Royal Darwin Hospital for a number of reasons, but one was they are a hospital that has had some tragedy within their department, and I thought it was important as president of the college to go and visit and talk to them. It was a very interesting trip. I had a chance to catch up with Edith Waugh, who is undertaking a PhD in Indigenous Perioperative Medicine, so a very important priority for the college. But it's very interesting to walk into a hospital like Royal Darwin, particularly for someone like me from the eastern suburbs of Melbourne, to see the number of First Nations patients in the hospital, but also met with Edith's Indigenous Advisory Group, and the disparity, the gap between most Australians and Aboriginal and Torres Strait Islanders is very big and very concerning. However, the college is playing a role in trying to close that gap, and I think it is something we really do need to support. The other thing in my visit to Royal Darwin is it is an exciting, very interesting place, And I encourage those, not only people who are interested in training there, and one of the opportunities I came across is to train with Care Flight in aeromedical evacuation, both helicopter and fixed wing. So there are opportunities such as that in Darwin. But I think we should also consider those who might even want to take a sabbatical in Darwin. The department are a great bunch of people, very interesting work, and it also support further clinical care for our First Nations people.